Hello, everyone, and thank you for tuning in today for our conversation around Medicaid postpartum extension and the benefits in Florida. My name is Erin Jones. I work at the March of Dimes as legislative counsel, and I'm glad that you're here today to join us for this program because we want to talk to you as health providers and healthcare providers in Florida, and for women who might be pregnant, women who might be experiencing postpartum, and persons who are eligible for Medicaid. Today, we're going to be talking to some of our experts who can shed some light on postpartum Medicaid extension and how important it is, how it works, the roles that you can play as a healthcare provider, the role a parent or a woman who's looking for services plays, some of the information about the benefits, and how to direct people to the care and information that they might need to make sure that they're utilizing their postpartum care benefits as much as possible. So, hi, we're going to start with our first guest, who is former Florida Representative Brown, and she was a huge supporter of the postpartum Medicaid extension policy that passed in Florida. And Representative, could you please tell us a little bit about why you were so passionate about this particular issue and why you felt so compelled to sponsor the bill, and what you hoped it would accomplish by having this bill pass?
Thank you, Erin. My passion surrounding the maternal mortality issue stems from a loss of a loved one. My god sister, April, who was a mentor to me and such a beautiful person and a huge part of my life, lost her life while giving birth to her daughter. April was a very healthy young lady, graduated at the top of her class at University of Florida, and was actually headed to training at the FBI to be an FBI agent. Her death really is something that I continue to live with and question as to why, because here we are, a healthy, beautiful, vibrant young lady went in to experience one of the most joyous experiences in her life, very monumental, but unfortunately was unable to go home to care for her baby. Extending postpartum Medicaid benefits can really save lives and definitely improve our health outcomes here in this country. Every woman deserves to experience that special moment, but also deserve to go home with their child to raise it and make sure that they become productive citizens. And so it was important for me just hearing the stories, the many stories from family members who grieve these losses but are left to care for many of these children. It was important for me to do my part for advocating for many of these women who lost their lives and these families who deal with this loss. We had the opportunity in 2020 to pass legislation that would extend healthcare benefits from 60 days to 12 months. And so just from the continuous advocacy over the years, I went to our speaker to tell him just the importance of this and how we can really improve some of the outcomes we were having. A lot of times we focus only on infant mortality, but not women. And so it was through his support we were able to work or bipartisan and pass this great legislation here for Florida. Every woman deserves to go home with their baby. And so it's important that we, as healthcare advocates, as lawmakers, as providers, but also as human beings, do our part to make sure we transform healthcare and transform many of these communities. But more importantly, make sure we are able to save lives. This extension could give possibly nearly 500,000 women the opportunity to improve their health. So many times they lack the support that they need, but this particular extension gives them that support that they need after childbirth.
Next, we have Allison Yeager. She is the Executive Director of the Florida Health Justice Project and an expert in health policy. Allison is here today to talk to us a little bit about the pregnancy Medicaid extension and specifically the postpartum provision and how important this is and how it will actually work. So Allison, can you give us briefly an explanation of what the postpartum coverage extension is and how it will work?
In 2021, the Florida state legislature passed a really important new law which extended coverage of the postpartum period for people whose pregnancies were covered by Medicaid. In the past, it had been that if you had Medicaid coverage for your pregnancy, that coverage ended just 60 days after the pregnancy ended. Now, with this new law, that coverage goes for a full 1 year after the end of the pregnancy. And I say 1 year after the end of the pregnancy as opposed to after the birth, because this coverage also supports people who've lost a pregnancy. So it supports people who've had a live birth as well as a fetal loss. And so this coverage period, like I said, will be for a full 12 months, and it covers all services that Medicaid covers. So not just services related to the pregnancy, but preventive services, specialty services, mental health services, behavioral health services, all of that will be covered. And we're really hoping that people will know about this extension, that they'll understand the extension, and that they'll take full advantage of the extension, because it really is an opportunity for new parents to improve their own health, and as a result, to be able to take better care of their infant.
Thank you, Allison. I appreciate that you talked a little bit about some of the benefits that are covered during this postpartum extension, as well as talking about the fact that parents who are suffering a stillbirth or potentially a loss, I think that's critically important for parents to know that they also have coverage and opportunity to receive services for that full year. Can we talk a little bit too about how the postpartum extension will work with the unwinding of the public health emergency that we all keep hearing so much about, and specifically how that will change continuous eligibility?
Since March of 2020, we have been in what's called a public health emergency, which is a federally declared status with certain conditions associated with it. And all of this is because of COVID. So in March of 2020, in response to COVID, Congress passed some significant legislation. And one piece of that was the opportunity for states to get more funding for their Medicaid programs, in exchange for which they promised not to disenroll anyone from Medicaid. So that means that since March of 2020, anyone who's been on Medicaid, anyone who was on Medicaid in spring of 2020, is still on Medicaid. No one's been taken off of the Medicaid coverage. But that's going to come to an end. We now know that that's going to end as of March 31st of this year. So the state is going to begin the process of redetermining whether people are still eligible for coverage. That process is going to go on probably for a full year. So it doesn't mean that everyone who's ineligible will be disenrolled all at once, but it does mean that we're going to begin seeing waves of people losing their coverage. So that means that for someone who is now no longer eligible because their 12 months of postpartum coverage has already come and gone, they will be disenrolled. They'll get a notice from the Medicaid state agency or from DCF, and that notice will let them know that there's been a change in their coverage status. Unless someone is newly pregnant or newly postpartum, maybe they're on to pregnancy number 2 at this point, in which case they should be sure that the state knows that. But if their pregnancy for which they had coverage ended and the full 12-month postpartum period has also ended, they will be losing coverage. So people should anticipate that. On the other hand, if your pregnancy ended less than 12 months ago, you'll still be in a coverage period. You'll still be covered. But now that clock really is running, whereas the clock was kind of paused while we were in this sort of suspended state. So now the clock really is running, and people will lose coverage at the end of that 12-month postpartum period. It's confusing. And if you have questions, you should talk to your provider about it. You should talk to Healthy Start or another social service provider that you're connected with. You can reach out to your local legal aid office. So there are resources for people who have questions. You can reach out to us at Florida Health Justice Project. But that is the broad brush strokes. Is now that 12-month clock really is in effect.
Thank you for saying that. I think those are critically important things for moms to know. They may be enrolled right now, and there could be some end coming to some of their services. But the good news is that if you are in Medicaid and you have, after a birth, you still have coverage for a full year, which is wonderful. And it's really great that parents will be able to get services that they need to get. So thank you very much, Allison. I appreciate your time today.
Thank you.
All of your information was very helpful. Thank you. Next, I would like to introduce Dr. Judette Louie, who is a faculty in OBGYN at the University of South Florida, who also happens to be a Board of Trustees member here at March of Dimes. And she's going to talk to us a little bit more about Medicaid postpartum extension, and specifically, how can the Medicaid postpartum extension improve maternal outcomes in the states?
Thank you so much for the opportunity to talk about something that I'm extremely passionate about. We know that consistent access to healthcare is vital to women and to their families. Particularly, having healthcare following childbirth means that there's an opportunity to optimize the health of these individuals, to address any of the pregnancy-related health complications, and to promote their overall well-being and health. And healthy moms equals healthy families and healthy children. In 2019, there were 63 maternal deaths in the state. Nearly 35% of them happened after the delivery hospitalization. And that's something important for people to understand, that moms are not just dying in the hospital, but they're dying after they've gone home. So that means we have an opportunity where if we make sure that they have appropriate health care after they've left the hospital, we can try to prevent some of those deaths that happen. The most common causes of those deaths include cardiovascular disease. They include thrombotic events, as well as hypertension. And while we may not be able to predict thrombotic events, we surely can help optimize the outcomes if we can optimize their health care for hypertensive disease and cardiovascular disease. If we provide continuous care for 12 months postpartum, covered by Medicaid and CHIP, those patients will have access to primary care for their chronic conditions, and very importantly, mental health care. We know increasingly that mental health care is difficult to get, difficult to fund, but through extended postpartum Medicaid, they can have coverage for that. So overall, I would say extending postpartum Medicaid is critical. In the past, individuals used to have their insurance cut off at 60 days postpartum. And so that meant really you had a short amount of time to optimize their health. And then many of them would go into this coverage gap where they had no health insurance because either they made too much to be eligible for Medicaid, but too little for them to be able to have subsidies to pay for a private plan. And many could not afford to purchase insurance from their employer. So they went uncovered. And as a result, they did not have access to care. Now we have an opportunity to make that go away. And we also know that if you look at the existing data from states that extended Medicaid, it directly translated into more utilization of healthcare. And so we have a lot of reason to be optimistic that extended postpartum Medicaid will result in the same for our patients here in the state. It's a wonderful opportunity for us to prevent some of these adverse outcomes, help prevent some of the deaths, and make sure that these women are going into their next pregnancy healthier. And if they choose to not have another pregnancy, that they are healthier overall.
Great. Thank you. I appreciate that. You really gave us some really good tips and understanding why this is so critically important for women after they give birth. So they get lots of care during, and it's really important that they continue that care through the first year. So I appreciate that. Given the fact that you are also a provider, what kind of message can you give to other providers on how they can encourage or be sure that their patients are taking advantage of this postpartum benefit?
I think the first step is just knowing that it exists. So many patients do not know it exists. And so you, as a healthcare provider, need to talk to your patients about the fact that they will have coverage through 1 year postpartum. But then also, as you're going through the pregnancy, reframe your thinking that your job is not just for this pregnancy. There's a lot of good data out there to show that what happens in pregnancy predicts the future health. And so if they've developed gestational diabetes, they're at higher risk for diabetes in the future. If they developed fetal growth restriction or hypertensive disease, they're at risk for cardiovascular disease earlier. And so just making sure you know that and that you communicate that risk to the patient, but then also come up with a plan that includes the postpartum period. So if they have these complications or these chronic conditions, it's not just saying, oh, we'll deliver you at 39 weeks, but also in the postpartum period, here's what we need to do. We need to see you sooner than 6 weeks for blood pressure checks, for example. We need to control your blood pressures. We need to reduce modifiable risk factors for heart disease, things like that. And so if you start having that conversation early in pregnancy, that helps frame it for the patients and helps to help them understand how important it is that care continue. But then also you should make sure that whatever referrals are necessary, that they happen in a timely fashion. So if it takes a super long time to get in to see a subspecialist, you may want to place that referral earlier while they're still pregnant. So for example, for my patients who would qualify for bariatric services, I may make that referral while they're still pregnant. They can make a care plan knowing that they'll still have coverage in the immediate postpartum period. And in fact, that's what I've done for some of these patients. So if they need to see cardiology, et cetera. So that's one strategy. Keeping in mind, it's not just referrals, right? That, you need to think about things like postpartum care coordination. Having a multidisciplinary team can be very helpful. So things like having a case manager or care coordinator, family medicine, breastfeeding support, WIC home visits, housing, transportation, et cetera. All of those services, now become easier to attain for patients during that extended postpartum period. So, one of the things you can do is to either make sure you have that team or understand where the patient can be referred to. I would also encourage obstetric care providers to not forget the patients who've had a miscarriage or a stillbirth or a neonatal death, that those individuals also need that care after they've had this, terrible outcome, particularly mental health services, and that they qualify too. And so keeping that in mind, and don't just sort of, drop those individuals. We do encourage everyone to stay up to date on resources, pertaining to postpartum care. One of the things that you can do is that your, clinic staff can help assist those who don't have insurance by connecting them with community resources that can help them apply for coverage, or direct them to the website www.myflfamilies.com to apply for coverage. So lots of ways that obstetric care providers can help.
Well, you certainly gave us a lot of tips there. So I jotted down a few myself so that I can remind myself of some of the things that you talked about. And I just want to underscore that how critically important it is for that conversation to happen with the patient so that they understand you have these benefits available to you. Please utilize them. It's a great opportunity to continue your care. I know as moms, right, we always sometimes put off our own care. So thank you very much for those tips. I think those are critically important for all of us. Thank you very much.
Thank you.
So joining us now, I have Melanie Silverman, who is the Chief Clinical Officer of Pacify. Melanie, we'd like to ask you a few questions from your perspective. Could you tell us a little bit about what Pacify is as a company and the benefits that you offer Medicaid members in the postpartum period?
So Pacify is an app that pregnant people and new parents download to their smartphones. They press a button, and in less than a minute, they can connect with a doula or lactation consultant live in video 24 hours a day, 7 days a week. This really means you can call anytime, day or night, as many times as you need. Pacify also provides educational resources and helpful reminders, so expecting and new parents can make informed decisions about their health and the health of their babies.
So the next question we'd like to ask you is a little bit about some of the common issues that moms might be asking Pacify about.
So I bet that every pregnant or new parent has at least a couple of questions about what they are experiencing physically and emotionally, but it's probably hundreds of questions. Pacify has the answers. Questions during pregnancy may be around how the body's changing, how to handle nausea, and pain management during labor. When feeding a baby, Pacify has many answers. And we get a lot of questions about breastfeeding, such as latch, engorgement, how to pump and return to work, and a lot of questions about medications and breastfeeding.
So earlier, Melanie, you had talked a little bit about doulas and lactation consultants. Can you talk a little bit about how Pacify makes referrals back to healthcare providers? And can you give an example of how that might work?
Absolutely. So yes, we do make referrals back to healthcare providers. Pacify is actually a care extender and not a replacement for in-person visits. On each doula call, there are discussions around creating a birth wish list, choosing a birth partner, and the importance of regular prenatal visits. From all of these discussions, referrals back to healthcare providers happen. And with our lactation consultants, they certainly answer questions about feeding babies, but there's always an emphasis on the importance of making and keeping appointments with local care. Pacify wants people to engage in their local healthcare, and so we make it part of our discussions when we're on the calls.
Our fourth question for you today is talking a little bit about the support that Pacify provides. Do you consider the support to be preventative?
Absolutely. Pacify thinks about preventative care in 3 ways. First, there's solid data on the benefits of doulas when it comes to maternal outcomes. There's decreased use of medications during labor and reduced C-sections. Also, it's well documented that breastfeeding provides health benefits to both mother and baby. The second way that we look at Pacify being preventative is we have to talk about maternal mental health. I cannot tell you how many people call, get the help they need, and feel so much better. They were feeling so alone, feeling very stressed. And so we're able to make them feel calmer so they're able to take care of themselves and their baby. And finally, our technology is able to deliver educational content and helpful reminders anchored around a baby's due date. And our data shows that there's increased rates of in-person perinatal care visits, increased vaccination rates, and increased breastfeeding rates. So Pacify is definitely in the business of preventative care.
Since not all Medicaid patients and recipients will actually have this specific benefit, what should patients do if they're listening to this and they're really interested in getting this kind of support?
So patients should reach out to their health plan to find out if Pacify is available to them at no cost. If it's not, they should ask what services are available through their plan to address lactation and doula support.
Well, Melanie, thank you very much. And I want to thank all of our contributors today for our program. And let's all do our part to ensure that Florida's Medicaid postpartum extension is fully utilized and creating a better outcome for thousands of patients in Florida. Thank you all for tuning in. Have a great day.